Thank you for joining us for another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And this episode is brought to you today by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, and highly effective approach to optimize wellness. It's a wearable device that puts frequency better based life on your wrist and on your hands. Make sure to stick to the very end as usual, because we always have a very special giveaway, but you're not going to want to miss 1 second of what my next guest has to say. I met him last year at a Lyme disease conference, Lyme Bites, and just absolutely fell in love with everything he had to say. I was like a little groupie afterwards. I'm like, you just don't hear a whole lot of doctors who talk about the importance of toxins and, all the lifestyle stuff that us functional, coaches talk about. And so it was just great to have a doctor and just so knowledgeable and so passionate about what he does. So I'll stop gushing. Without further ado, let's welcome Dr. David Dornfeld. Dornfeld, did I say it right? Yay.
Yes, sir.
Yay. Dornfeld to the show.
Hey, how you doing?
I'm doing awesome. So excited. I've been excited for this.
Yeah, it's been quite a while since we saw each other there at the lineup.
It has. It has. How's I would love to know, and for our audience to know, like, how did you get into the line of work that you're doing now? What made you want to become a DO when you grew up? And, why are you talking about some of the more harder, complex stuff that you talk about?
Well, I think that the world does not need to be tunnel vision like most allopathic physicians, MD world. They seem to follow algorithms and go down their pathway, and they don't seem to think outside the box as much. And they're really smart MDs, so don't take anything I'm saying out of the ordinary. I like hands-on. I like the philosophies that a chiropractor or a holistic healer would have. So a combination of both MD world and chiropractic world is an osteopathic world. So I'm not limited. I can do spinal adjustments, and I'm one of the strange docs who do spinal adjustments for their patients to try to relieve the lymph drain, enhance lymph drainage, reduce inflammation, etc., through various modalities. It's structure and function relations, and that goes along with everything that I always talk about, which is how can we keep our diet and environment as clean as possible in order to promote the quality of life and prevent disease. Because that's it. It's not you are what you eat. It's you are what you eat eats, which you can excrete. So if people would get that in their mind, it's not you are what you eat. What does he mean you are what you eat eats? Well, if I'm eating a chicken and it's being fed genetically modified corn, I'm eating genetically modified chicken. And therefore I have now Roundup because 90% of the corn has Roundup in it. So that pesticide is going to eradicate my microbiome. My microbiome controls 70% of my immune system. My microbiome, which is destroyed by the chicken that ate the corn, also controls 80% of my neurotransmitters. So do we have a problem with depression and anxiety and mood swings, etc. in this country? Sure. I try to teach people how to eat. And then once we learn how to avoid certain foods, then get their detoxification enhanced. And then once we get their detoxification enhanced through a various array of possibilities, then we want to get them to exercise and sleep and laugh and have good relations. When I found out about hyperbaric therapies in 2005, by adding that little caveat of throwing extra oxygen under pressure into the plasma to enhance the cellular function and to make ATP easier and to rid some anaerobic infections and to improve cerebral perfusion and help with dementia, holy crap. This world is now a 1, 2, 3, 4 punch because you have to diet and sleep and do all the things that, you and I talk about when we go to various conferences. I've been speaking for autism conferences since 1995.
Whoa.
And I'm sorry, I've been involved with integrative medicine since 1994 and 95. I started getting involved with autism and started speaking in 2005 and learning about hyperbaric therapies. And I'm usually a speaker at every one of the MAPS conferences. That's where we learn about autism, the Medical Academy of Pediatric Special Needs. That's a really good way of patients, as well as parents, as well as doctors, to learn about this, how to improve an autistic kid. I enjoy medicine, thyroid, cancer, diabetes, high blood pressure. That's routine stuff. When you take care of a person who's trapped in a little body and you get them to speak and to I have autistic nonverbal kids that I saw when they're 2 who are in college now and driving cars and going to proms and doing everything because of the world of enhancement, of their detox capabilities and the proper nutrition and get their biochemistry going. And when we throw that hyperbaric twist on board, it's fabulous.
So you did have a bit of a pain to purpose story. You had your own reasons to want to dig deeper than just, take this pill or this is their diagnosis for the rest of their life and nothing's going to change, right? Like I get so
Right.
sick of that, especially like in the autoimmune world. It's like, oh no, they told me I have to be on this biologic for the rest of my life and it's not curable. I'm like, bullshit. I've reversed 2 of my autoimmune diseases. Like it's
Yeah.
possible.
Absolutely. I do a slideshow for the community and I talk about the real weapons of mass destruction. And I show them this wonderful picture, and I'll show this to you. And that's basically what we have going on there is what we're eating. And it says, we have highly processed, pesticide sprayed, high glycemic, low fiber, food-like substances stored in plastic containers. And it's like a
Yeah.
rifle,
For those
you
of
know,
you who are listening, it's a machine gun shape, but it's made with food.
yeah, it's really
Inflammatory
complicated.
foods. You can't even call it food, right?
Exactly. And that sets up such a Pandora's box of inflammatory cytokines. And these messengers send out information to the various portion of the body, and it adds to leaky gut and enhances your nutritional deficiencies because you're not putting anything inside of you. And when we are trying to take care of people, if we don't take care of their chronic infections, their leaky gut, their dysbiosis, their sleep disorders, their nutritional deficiencies, their endocrine and psychologic dysfunction, we're not going to win. A lot of people have mitochondrial dysfunction. People think they have to have a mitochondrial disease in order to have a problem. No, mitochondrial dysfunction, your mitochondria, your ATP producing powerhouse of your cell, has some problems in its processing of the food that you're giving it. If you can't get carnitine to bring the fatty acids into your mitochondria, and you can't use CoQ10 to make ATP with oxygen, you're not going to survive. Well, you're going to be chronic fatigued and drained, and your skin and your hair and your body is all going to have backup problems. So we want to try to find out how can we enhance their detox capabilities. I always tell patients, think about all these little demerits that you're putting into your body. You're using underarm deodorant that has aluminum in it, that's a neurotoxin. You're eating chicken that has arsenic in it and corn in it that has Roundup in it, which has mold, by the way. And then you're adding that to your body. You're eating sushi tuna, ridiculous, because it's loaded with mercury. And don't even look at a picture of a swordfish because it's loaded with mercury. And I love my patients when I see them in public at a restaurant and they're eating swordfish. I was like, what are you doing? You listen to anything
I
that
have
we
friends when they see me at a barbecue, they literally take their food and they try to hide it from me. And I'm like, I'm not on the clock right now. I'm not going to judge you. Now, if you were to pay me and you were my client, then obviously I would say something about your choices in food and how you're feeling. But no, I'm not going to be the food police at the barbecue.
and you're eating fish, and if it's a large fish, it has mercury in it. The,
Yeah.
the half-life of a drug is how long does it take a drug to leave the body, half of it to leave the body. And the half-life of, let's say, amoxicillin I gave you, let's say the half-life is 6 hours, and I gave you amoxicillin, you call me up and said, I have a rash. I would say, okay, it takes 5 half-lives, 5 times 6, 30 hours for that medicine to be completely out of your body. The half-life of depending on your detox capabilities, the half-life of mercury can be up to 20 years. So that sushi tuna that you had yesterday, it'll take 100 years to get out of the body. And I gave this talk during the lunch lecture at the MAPS conference once, and there had tuna out there. And I like, you mean that tuna that you just ate out there? That's a problem? I was like, yeah, it is. Did I have tuna? No. When you're out in a restaurant, you're out at a conference, you can't control everything that you're going to eat. So if you're going to eat extra pesticide containing foods, why not take some extra protection like more probiotics and Saccharomyces and growing surfaces to allow your bacteria to be better?
So you
You
prefer the probiotics over like the binders if you're going to eat out and have some of this stuff?
Yeah, depending on what I'm eating, binders will bind anything within 2 hours of it, but sometimes it's binding your nutrition as well. So you don't want to do that. If you have a really moldy food, yeah, I'd throw a binder in it before you go to bed. But I take a probiotic every day between 25 and 100 billion colonies every day. I rotate every month. I think that's important. And then if I'm going to go out to a restaurant, I'm going to my friend's house, they're having chicken wings. Their chicken's not organic. Their, hot dogs are nothing near organic. I don't think you can make a hot dog organic. Uh, I'm going to take an extra probiotic that day, and to keep your microbiome in control of 70% of your immune system, again, and your neurotransmitters, it's really important. Toxins get into the body through the lungs, you breathe it in, through the skin, you take a shower in what kind of water? Oh, I should get a shower filter for my community that might enhance less problems. So if you listeners out there don't know about the Environmental Working Group, please go on the ewg.org site and then type in shower filter and then type in your zip code, and it'll tell you what shower filter you need for your zip code, because the skin being the largest organ in the body, you want to try to reduce the toxins going into it. We get it from our food, we goes into our system, and then all that toxin that gets into our body has to get processed through the liver, and then it gets excreted through the skin, through the kidneys, through the colon, and through your lungs. But if you don't get rid of it, it gets stored in your fat cells. And the heavier you are, the more problems people have. Why did the obesity epidemic start to rise from all our crappy food? And why did we notice that COVID patients suffered more if they had obesity? Because their immune system is stuck because they're loaded with toxins. Fat cells love to absorb toxins. And you can get toxicity symptoms of constipation and chronic fatigue and hormone imbalance that really all add up. And you're not going to take care of that person in the thriving world if you can't let them detox.
It drives me bonkers. Even when I run into, God bless them, these Lyme literate doctors, but they're still stuck in that old paradigm of kill, kill, kill. And, I talked to a client that just came from one, and they're on all these antibiotics and, herbals. And I'm like, when was the last time you pooped? Oh, 4 or 5 days ago. And I'm like, no, you can't go to war with a person's body who's toxic, who hasn't pooped. Like, you're going to get 10 times sicker.
Right. You have to drink clean water, and you have to drink water to the amount of 60% of your weight in ounces of water, usually, unless you have renal dysfunction, then you'd be limited. You have to eat quality food. You have to poop daily, once a day or twice a day. Because if you're not going to get rid of stuff, you're not sweating. There's people who can't go in a sauna and sweat.
Yep.
They have some detox.
Yep.
Yeah. So once you figure out how to open your channels up, then you can get things to go. Why is the symbol for autism a puzzle piece? It's not clear, easy understanding of how that you need to do this, this, and this, and this, and your autistic child will be fine. No, everybody's different. You have to work it individually, and you have to get their body to make like a symphony orchestra. You can't just have the string instruments working, and you can't just have the keyboards working. You have to have the entire biochemistry of their body, their dietary factors. And that's true with everybody, with Lyme, with energy problems, or chronic fatigue patients. If you can find an agent that'll give you some energy, that'll help your body make ATP, then you got it made. And then when you look at the results of what you can do with hyperbarics, it goes to the next level. I'm so happy about that.
Yeah, I'm excited to jump into that too. We're going to take a really quick break here because a detox has always been and always will be one of my favorite conversations. And I love that Nikki has detox on their frequency thing, because I think if you can come at it at a couple different ways, right, you're going to help a couple different areas in your life detox. And this world is just not conducive to human health. And I think we need all the support that we can get. So I'm excited to learn more about hyperbaric. So don't go anywhere. We'll be right back.
There's a new word for wellness, Nikki. Nikki, the bioenergetic wearable designed to help you feel better and perform better. Other wearables just track how you're doing. Nikki is about helping you do better. Touch the Nikki screen to choose the frequency you want for what you want to do and how you want to feel. Nikki puts a personal wellness center in your hands and on your wrist. Be better. Do better. We are Nikki.com.
I have struggled with sleep for a while, so I do know that it affects everything, but having insomnia, that's something that would never wish upon anyone. Like, until you don't realize how important sleep is until you lose it. And when you lose it, you really, really realize how much it affects everything. It affects everything within the next day, and then a few days after that. It just like it creates this vicious cycle that you can't get out of. And so that was huge for me, and that was one of my biggest priorities of 2022, is trying to get my sleep back on track, and at least just sleeping for a few hours every single night, or not waking up every hour on the hour. And the very first day that I wore the device, I slept through the night, which is amazing.
Nikki puts a personal wellness center in your hands and on your wrist. Be better, do better. WeAreNikki.com.
Fantastic. Well, let's jump deeper into hyperbaric. Like 2005, that was really before a lot of people, I think, had been taught. That was like before you're definitely a forerunner, I'm seeing. That was before people really are talking about it. And yeah,
Clinics all over the place. They're popping up left and right.
that's all. Yeah, I can't go anywhere. There's not one health conference I went to this last year that didn't have a hyperbaric person, or two different companies at the shows. So yeah, it's definitely so tell us a little bit more about what is it, why, how does it work, like all the fun stuff about hyperbaric, because I really don't know much about it.
Okay, whenever you're ready.
Yeah, you go.
So can you see this? Because if you can, it's great. And if you can't, I'll try to explain it. When you bleed, so this is a picture of the red blood cells, and then the clear area around it is the liquid. And in the first picture, you can see that there's no little dots of oxygen, or very few little dots of oxygen in the liquid around it. And under hyperbaric conditions, the red blood cells around it in that liquid, that plasma, is bathed in oxygen. So when you cut yourself and you bleed, you're dripping red blood cells, and then you're dripping a liquid plasma. If you put a pulse oximeter on people to measure their oxygen saturation of the red blood cell, in room air, if you're not a smoker and you're at sea level, you're probably about 98% oxygen saturated. The liquid portion, the plasma, has minimal amount of oxygen in there. Why is that important? Well, let's put nasal oxygen on the person, and now their blood gas goes up from 98% to 100%. That's great. But what happens to the liquid portion? It still remains that it has minimal oxygen dissolved bubbles. Under hyperbaric conditions, under pressure, you can force oxygen into really small bubbles, and that can diffuse into the plasma, the liquid portion, where the big red blood cells can't permeate into the tissue well, because the hardening of the arteries, because you've had injury, it will not allow for oxygen diffusion into those tissues. And that causes death to the tissue, or poor nutrition. What happens when you have a stroke or a heart attack? That area downstream of the blood clot, or whatever is causing that area to be devoid of oxygen, is going to suffer the consequences of poor oxygen supply, and then tissue death will occur. Well, if we can enhance delivery of oxygen to the distal, the far end of these blood vessels that are narrowed, or the area which your stroke is, or the area where your heart is, or in your colon when you have some small tortuous blood vessels, you will enhance delivery of oxygen into the plasma, which crosses the areas where the big red blood cells can't get into. What does that do? Again, go back to the mitochondria story. You can't make energy without carnitine, CoQ10, oxygen, water, nutrition. If you don't have oxygen going to the cell is not going to work well. And the mitochondria, the energy producing organism of our body, they get older and they stop functioning. Well, hyperbaric actually enhances the functioning and allows them to replicate quicker as well, so we can get tissue repair. People think about hyperbaric oxygen therapy. They say, oh, my insurance won't cover it unless it's 14 Medicare approved conditions, including burn injuries and carbon monoxide poisoning and crush injuries. Yeah, those are covered by Medicare. But there are so many people who have neurologic disorders: autism, Parkinson's, multiple sclerosis, Lyme disease, candidiasis, Crohn's disease, scleroderma, autoimmune diseases, thyroiditis, poor healing, poor sleep, anxiety, depression, headaches, that get to relax in a cylinder that you zip up if it's a plastic one, the vinyl ones, excuse me. The soft chambers go to 1.3 atmospheres legally in the United States. They go higher pressures in other parts of the world legally, and our FDA doesn't allow us to go above 1.3 with a United States built hyperbaric chamber, which is fine because all you need is a little bit of pressure for neurologic repair. If you're going to talk about Crohn's disease and you want to stop an ulcer deep in the tissue, yeah, 2.4 atmospheres is what you need to heal those ulcers, but you don't need that. You need low pressure for most conditions. So I've been using exclusively in my practice since 2005 soft chamber hyperbarics, which is 1.3 atmospheres. And the naysayers say, oh, you have to use 100% oxygen, you have to go into a hard chamber, you have to raise it up. No, the seizure rate actually goes up if you use high pressures too quickly. You can go slower and get up to pressure properly, but you don't run into problems. And the repair mechanisms are phenomenal. The dementia improvements, the post-COVID improvements, it's so easy. It's 2,400 milligrams of Motrin without the GI and kidney side effects of one treatment. And we've had people improve their rate of fractures reduction by 40%, get out of a cast 40% faster by going in a chamber. It just has so many implications. In Lyme world, which you see, because we both deal with Lyme quite a bit, is it helps with angiogenesis and mobilizes the blood flow to the areas that are inflamed. When you have TNF alpha, when you have inflammatory cytokines, C-reactive protein, another one of those inflammatory markers, they'll be skyrocketing when people are inflamed. Hyperbaric therapies, you do a blood test before and a blood test after, and lo and behold, you'll see after a series of hyperbarics, maybe not with one session, but it might take 4 to 10 to 12 sessions to get these inflammatory markers to go down. So when we look at ways to enhance antibiotic cell wall protection or to get permeation, when we get a cancer patient who needs radiation therapy, if you add hyperbarics to that, it helps permeate the radiation therapy to it. Your white blood cell.
Hold on real quick. So with the Lyme disease, it's not necessarily killing the Lyme disease. It's helping lower the inflammation so then the body then can do its job better when it comes to dealing with the Lyme disease. Is that how I'm understanding it?
Because it actually augments the antibiotic intervention by helping drive the spirochete out of the biofilms. So we know that our biofilms have spirochetes in them, or our spirochetes make this biofilm, and then you can use all different biofilm potions to try to open things up. And everybody has their own favorites, but when I love biocidin products. I really think that's a great product to use as a biofilm buster, as one of the mainstays. But I enhance that with hyperbaric. Am I going to kill spirochete with 2.4 atmospheres of atmospheric pressure of hyperbaric? You might at that dose, but I don't think you're going to get it all taken care of. I don't think you cure Lyme disease easily. I think you control persistent Lyme. If you got bit by a tick yesterday and you got an antibiotic course of 3-4 weeks right now, I think we're pretty all understanding that you're going to calm that baby down, and he or she will not come and rear its ugly head down the road. I'm not being sexist on the tick bite. If you got bit 2 years ago or 6 months ago and you weren't treated right away, you know that persistent Lyme is going to change its shape from a little squiggle to become a round body, and then put some slime around it, and now it's sitting there waiting to come out and get you when your body takes an immune hit. Well, it's buried in a biofilm, and if hyperbaric therapies can help enhance your penetration through that biofilm, with or without herbals or antibiotics to help permeate that area, life will be great. You want to help the person feel better. So if you can lessen the muscle cramping with oxygen, if you can improve their walking distance, if you can get their energy better, this is all we find with hyperbaric therapies. So I love it. I don't know if you can see this picture. Some of those who can, some of those who can't. So I like to use, this is from Shah Fradi over in Israel. He did some research. So this is your artery that will feed to a small area. Let's say in the middle there is where the ischemic zone is. So it's an area between the two arteries. And under normal baric conditions, the blood vessels are not going to feed that area. But when we add hyperbaric therapy, the permeation of the oxygen through that plasma goes into the tissue that will get to the ischemic areas between the blood vessels. So it's really amazing when a little bit of pressure forces oxygen into the areas outside the blood vessel wall and allow it to penetrate deeper. In the autistic world, it takes these sleeping neurons, these idling neurons that are not functioning well, and gets them to start functioning, and they become more present, more aware. They may start pointing. They may utter a few more extra words. You add some methylation, you add some detox, you add some sulfuration, some glutathione, some nutritional support, get rid of the food allergies, and wow, I got a little kid who actually is responding better. And then let's do some chelation rounds and get rid of the toxins that are in them. And then, oh my God, it's amazing. You must be familiar with Daniel Amen, right?
Oh, absolutely. I saw him speak just a couple months ago at a conference. I'm huge fan. I adore that man.
So the beautiful part about Daniel Amen is he was naive to hyperbarics. We went to a autism education experience, and I can't think of the name of that conference, Autism Education Summit in Dallas, Texas. And he was in the audience. I'm giving a talk on hyperbaric, and somebody else is giving a talk about hyperbaric right after. He's like, wow, I do SPECT scanning and I show brain function. And when you see divots in the brain function, and if we add hyperbarics, we can probably see improvement in our divots in our brain function. So when you have a brain that has holes in it, because that's what goes on. When you have a brain that has holes in it, when it's not functioning well before hyperbaric, and then after hyperbaric, you see it smooths out. Or before hyperbaric, the perfusion distances of where things are, of how before hyperbaric therapy on top and after hyperbaric therapy on the bottom.
That's
The
incredible.
idea is to get the functionality of the brain to enhance. And he has a number of Lyme patients that he's now done studies to show that you can, the area of global hyperperfusion, poor blood supply, poor function, is about 70% in these Lyme patients, especially when they have brain fog and they have multiple other co-infections and things like that. And you'll see that scalloping, that bumpiness of the surface. Well, you can actually enhance it and smoothen it out by using hyperbaric therapies. One of the most amazing examples of what he showed me on various times we've had a chat or I've seen him at a conference is he had a picture of stages of sobriety. So this is if you can see that,
Yeah.
that this is 30 days after quitting alcohol, 4 months after quitting alcohol with hyperbarics, and 1 year after quitting alcohol with hyperbarics, to allow the brain to become less of a Swiss cheese in its function. If you did a CAT scan or an MRI, you wouldn't see that. They're not looking for anatomy. A SPECT scan looks at functionality of the brain. So when you see brain function that's being restored with the use of hyperbarics in various diseases, it just blows you apart. So when you show that to someone, like, wow, all these studies, now I understand it. And if you add the hyperbaric to the detox, to the nutrition, to the stop the planet from killing us, then you get people healthy.
Can I get an amen? And you notice he's not a one-trick pony. He's not saying hyperbaric is the magic bullet. No,
No.
it's one piece to the puzzle, to the whole picture that you, same thing with the Nikki. I tell people all the time, it is not a magic bullet. You cannot slap this Nikki on your wrist, go eat McDonald's and expect to have this thing work. Yeah, smoke cigarette. Oh my gosh. Oh my gosh. Yeah. I used to be that one.
Drink Coca-Cola
Yeah,
and,
yeah, yeah.
and don't get any sleep and eat
Yeah.
McDonald's. Yeah,
Yeah.
it's a great idea.
But then Nikki, it doesn't work. The hyperbaric, it doesn't work. No. So how can you explain to us a little bit more detail how the detox portion, how it helps detox, especially things like mold?
So mold is a whole discussion in and of itself. So
Oh yeah.
you have to bind, you have to, anytime you are going to deal with a detox program, you have to shut the faucet off of things that are dripping into the bathtub of life. And then you want to open the drain of the bathtub of life and bind the crap to get it out. So either use a magnet like a chelator to pull it out, or a binder like a charcoal or one of those guys to pull it out, depending on what the situation is. But if you don't shut the faucet off from dripping into the bathtub of life, then you're going to end up continuing to have problems. So the first thing is you got to find out where you have mold, check your house, check your car, do what's going on, figure it out. Then you have to do things to enhance detoxification. So for mold, we use like glutathione and N-acetylcysteine and alpha-lipoic acid, and fish oils are really important, and grapefruit seed extract is really important, and binders are really important. So pick your binder of choice, rotate your binders around. Don't let your binders go near anything that you put into your body that's beneficial within 2 hours, because you're going to bind those beneficial items. But get yourself into a program where you can work your way into improving your mold levels in your body. Person comes in, I live in a moldy house. Okay, let's check your rooms of your house, find out which room is involved, get that thing taken care of. Let's find out if you have mold inside you. Do mold testing on you. I like doing urine tests to find out where the people are. We do some blood tests to get some ideas. Urine test says you have ochratoxin. Yeah, a lot of people have ochratoxin. No, you have gliotoxin and aflatoxin, and you have all the chitosan, and you have all these other things that you don't want in people. You need to get rid of the toxin. Find out, is it coming from your cereal? Is it coming from your non-organic coffee? Is it coming from your chocolate? Is it coming from your corn? Those are huge sites for, and peanuts and things like that. And then once we're not eating moldy bread. We know we're not going to eat moldy bread, but I like blue cheese. So am I getting moldy cheese? Sure. When I'm having blue cheese, I'm getting moldy cheese. So reduce the faucet dripping crap into your body, open up your binders to get rid of the stuff, and then enhance the detox. Get into a sauna, do some running. People do all sorts of stuff. They do tapping and they do, massage and trying to get their body to work better. If you're not exercising, and if you're not sweating, if you're not pooping and peeing, you're not detoxing. So how do we enhance that? Is by doing various things: oral chelators, oral binders, IV chelators, IV vitamin C, alpha lipoic acid. Those will help bind stuff.
How does the hyperbaric, because I know that's been a huge in the mold world, I'm talking to people who are using hyperbaric to help them overcome their mold stuff. So what is the correlation there? How does that work?
So you're not going to get rid of mold in the person as easily. I mean, you can reduce your yeast burden. So if you have candidiasis, you can see that hyperbaric does help in that regard. You're going to possibly enhance the therapies that you're using for your mold.
Gotcha.
To get better. It's not like I'm treating mold with hyperbaric. No, I'm treating the person who has a disease, not the disease the person has. I'm treating the person to work better by giving them hyperbarics and nutrition and vitamins and herbs, and get the body to work better. Throw them in a hyperbaric chamber for 15, 20, 30 times, hour and 15 minutes at pressure. You can't do it for 5 treatments. I see these people who have, by 5 treatments over at our clinic, we'll charge you 20% less by doing 5 treatments. They charge you too much to begin with. And then, they don't give them a long enough time. The patients will say, oh, I went to this clinic there and it was out of the area because I was visiting my friends in California. And I went for 2 weeks in this hyperbaric chamber. I said, how many days did you go? I went for 4. I didn't get anything out of it. I said, you were out for 2 weeks. You went for 4 treatments. Why didn't you go for 14? You can go in twice a day in a hyperbaric chamber. You go in for an hour, you come out for 4 hours, and you go back in again. When you're on vacation visiting these clinics, that's what you should be doing. Or you find a doc who has a chamber, or you find a doc who screens you properly that you're safe to go in a hyperbaric chamber, which is really important to make sure you don't have any contraindications. So don't say, oh, I heard a tape that Dave said I can do this. No, you need to be screened properly. And once they're screened properly, I put them into my office for a couple treatments. And then I say, you would do better by renting a chamber, putting it in your house, and going in your chamber 60 times in a 30-day period. You rent a chamber for $2,000, $3,000, depending on the company that you use it from. They'll ship it to your house. They'll charge you for shipping back and forth. You keep it for 1 to 3 months. You say, the money I put towards the hyperbaric rental, I'm going to put it towards the purchase because I love it. I feel great. I've had the opportunity to do this. And now I know that I'm screened safely. But again, the doctor who is in charge of you, who's going to write the prescription out for you to get a chamber, needs to know hyperbaric medicine. You don't want to go to Fred on the corner because Dr. Fred knows that hyperbarics helps, but has no idea what contraindications we have to watch out for.
Ooh,
so you
which are some of those? What are some of those?
So like if you had a history of a pneumothorax in the past, you have a history of emphysema, you've had a recent chest tube, you have sinusitis, chronic sinusitis. It's tough to go up and down.
That's me. I was in it, and I literally, within like a minute, I felt like my eardrums were going to explode. It was so much pain, and I was like tapping out, and they couldn't just let me out. They had to let it. But I was so sad. I was so sad.
You can't go on an airplane easily when you have a head congestion or a head cold.
Yep.
But you have sinus squeeze, and depending how fast the operator drops your pressure and how good the instructions are to get you down to pressure. Because I'm a scuba diver. And the first 2 times, 3 times on scuba diving, it's tough for me to get down the first 15 feet. And after you get it to do a couple times, then it's easy because now you've gotten that equalization of your ears much better. But there are some contraindications that are absolute contraindications. Pregnancy, you don't want to go in either, because even though you probably don't have a problem, but if you told a pregnant person they can go in a chamber, the lawyer would come after you no matter what happens, if anything happens, because pregnancy is its own world. But if you can enhance cerebral perfusion, if you can enhance the body's ability to reduce inflammatory cytokines, if you can reduce oxidative stress with the use of hyperbarics, increase stem cell repair, these are all things that everybody, not just the autistic population, gets by having hyperbarics. But if you can enhance your stem cells to help repair tissues because you went in for 15 or 20 hyperbaric sessions, the world is a much better place. So I love it, especially when you do everything else. It's that puzzle piece.
Yeah, absolutely.
I'll have patients who see me at a conference. I'll say, "Oh yeah, I really liked your lecture on hyperbarics. When should I get started?" I said, "Well, that's not the first step, like you said before. You got to do the other things before that.
Yep.
You have to warm you. Some people, if you, let's say you're a weekend warrior and I go water skiing and you take a nice fall and you wrench your neck a little bit or you twist your shoulder. Sure, 3-4 times in a hyperbaric session, you'll reduce the inflammatory cytokines. You'll help improve that situation. You'll feel really good. That's not what I'm talking about. I'm talking chronic disease. Chronic disease is not going to be improved upon immediately by starting with hyperbaric. If your gut's not working, if you're not pooping, if you're not detoxing, if you're not feeding right, you're not sleeping, you're not laughing, you're not doing all these other things, the hyperbarics is going to help, but it's not going to help.
Absolutely. Hey, so we're at the shameless plug time of the show. So where can people find you, learn more about this stuff? Because it does sound like that I think I've probably heard too many people who've gone to the wrong type of practitioners. And, like anything else, if you're not using the tool properly, and if you're using it as a magic bullet, you're just not going to get the full effects out of it. So where can people find out how to do this correctly?
So contacting the International Hyperbaric Association, ihausa.org, would be the first step, because those people who are trained in hyperbaric therapies, ihausa.org, they would be able to say, hey, in your zip code, there's Dr. X and there's Dr. Y who knows what's going on. So that would be the best thing, because you have to do hyperbarics in person. You have to find a clinic nearby. If you go online and you type in who does hyperbarics near me, that's not the answer. You want to find the properly trained ILADS doctor. You want to have the properly trained chelation doctor. You want to have the properly trained hyperbaric doctor. And those are the things you want to look for, not just who has the best advertisement. Okay. So I would do ihausa.org. I would look at acam.org, acam.org for finding out who's been properly trained in detoxification, or ICIM, the International College of Integrative Medicine, to find out who's well-versed in integrative medicine and who's been properly trained and take chelation therapy boards to prove that they are knowledgeable in these topics of detox. If you want more information from me, my email address is drdave@drdavedornfeld.com. Pretty easy. drdave@drdave, dornfeld.com. My website is my name as well, drdavedornfeld.com. And if I can be of help, just say, because I get a bunch of crap mail, so just say, I heard you at a talk and I have a question. I'll be happy to try to answer it. I'm not looking for new patients. I'm just trying to help people. And I've been doing this for 38 years. And I still get enjoyment out of it. And
How could you not, especially with these kids, like giving these people, you're giving them their life back. You're giving the parents their kid back. Like, I couldn't, that just seems amazing.
Well, I did 36 years of insurance-based medicine.
Ugh.
And I was nuts. That's at
I bet.
10 times. So the last 2.5 years is like, I can't deal with that. I can give you a receipt, you can send to your insurance company. I got to spend time with you and explain the facts of life. I can't do this in 8 minutes. You need an hour and a half to talk with a Lyme patient or a chronic diseased patient or an autistic family and get them to understand how to get their child to become their child again, get them to speak. That's the best thing. It's the absolute best thing. There's nothing better than seeing that kid, getting the parents to send you pictures of them, getting the diploma. I can't believe he did it. I can't believe she did it. We it's so gratifying to help a child unwind. Anybody who has autistic needs, please get your doctor to go to medmaps.org. MAPS conferences of are in March and in September every year, one on one side of the country, one on the other side of the country. The Medical Academy of Pediatric Special Needs is the best organization that I've ever seen. You learn more stuff on taking care of autistic kids, on how to take care of Parkinson's and Lyme and all those different diseases, because you'll learn biochemistry and understanding fundamentals of getting tough people to respond. So medmaps.org, the Medical Academy of Pediatric Special Needs. If you want to donate to a great cause, that's a great cause because they really do a fantastic job.
They're getting a coaching program put together, which I'm really, really excited about because I talked to Dr. New and I was like, ooh, ooh, ooh.
New took over that area. I mean, Dan Rosenthal did a phenomenal job before that, but he's just gotten so big. And New is amazing. 3 years ago, Dr. Tom Moorcroft, who you know quite well, he and I were doing Lyme conferences for many years together, and he does a lot more than I do. And I said, you got to go to a MAPS conference. It's like, well, get me invited to speak. So I spoke to the people who are in charge, and now he's like one of the co-chairmen of the conference.
Oh,
And
yeah.
he loves it. He absolutely loves it because he does more Lyme and pediatric Lyme than most other docs. Between his, Charles Ray Jones was his mentor, and Rich Horowitz was our mentor together, or still is. But it just the people that you get to meet and the fun you have by sharing information and how did you get this kid better, and it's just amazing. And if you haven't seen the movie Spellers, please go see the movie Spellers.
Spellers?
Spellers get these nonverbal children, adults, who can't utter a intelligible sound that you understand, and they get a little bored and they spell out words, and then eventually they learn how to type, and they are brilliant. Most of these kids are trapped. They have an amazing memory from their beginning of life. They are brilliant savants. They will type things out and then explain in better English than most college professors. They are unbelievable. So when you learn about how trapped these kids are and what they can do, and there are a couple of really important leaders, they should run for Congress.
Absolutely. Thank you so much for your time today. I so appreciate you and all the work that you're doing in the world. Everybody else, make sure to go check out his website. And while you're there, also go check out wearenikki.com/podcast. Make sure to enter in BioBeats for 10% off. But because we really love our customers, and our way to show appreciation is we give away on each episode a Nikki device with the wellness set of frequencies. I think it's a $597 value, so don't miss out. You can get that information in the show notes, but make sure to stick around with us next time. Have a healthy day. Thanks.
Bye-bye.
Hey there, my name is Jer. I'm an art director and a graphic designer. My wife and I have 2 grown sons. Both are starting their young careers apprenticing in their fields of passion. And then there's our favorite son, our 7-year-old puppy, Andre. Andre has been the best addition to our family in the last decade. When the pandemic hit 3 years ago, my career was turned upside down. I started working as a contractor for a few clients and working from home. I haven't looked back since. My schedule with work is hectic and often stressful. I have two ways of dealing with my stress and anxiety. Number one is my dog Andre, and number two is my bioenergetic wearable, Nikki. When I need help with my work-life balance, I use my Nikki in stress and anxiety mode. And I have a puppy break. My Nikki touchscreen watch is pretty easy to use. It's cool that I can dial up individual frequency sets. When Andre is ready to go, I tap energy. I've been a longtime hockey coach and play in goal twice a week myself. I find the pain mode has reduced the inflammation in my legs in particular. The nighttime mode has been great. I charge my Nikki every other day at my desk. I've been wearing this cool tech for almost a year. On the latest update, I see there are some new frequency bundles. There's morning, afternoon, evening, on top of nighttime.
Nikki puts a personal wellness center in your hands and on your wrist. Be better. Do better. We are Nikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.